So I guess the story for what we're talking about today probably starts with acknowledging that in paramedicine we have a lot of different patient groups where we want to focus on the care that we deliver to them because it's probably not where it should be. And one of those groups of patients are LGBTQIA patients, because they're a high risk population. When we talk about high risk populations, essentially what we're saying is that there's specific risk factors in that population, which means that they have worse health outcomes, but also perhaps that the care we deliver isn't where it can be in terms of giving them the best opportunity to receive um, improvement in their health where it's possible. And so LGBTQI patients are one of those groups that are high risk. And when we talk about them being high risk, we talk about certain factors that sort of play into what makes them high risk. So 3 in 5 LGBTQIA patients, and today I'll focus specifically on young patients, receive verbal abuse. 1 in 5 are victims of physical assault. If someone is transgender, then there's a 1 in 3 chance that they'll be physically assaulted. And we know that roughly 1 in 5 young LGBTQIA people are contemplating suicide. And these stats come from around sort of 2018, 2019. And because it's difficult to do research in this population, they're only updated every few years. And so hopefully there's new research coming out later this year in Australia, which will help to inform this. But so far, the data we're seeing looks basically the same. There's a particular stat which I found really upsetting, which is that 1 in 10 kids in Australia don't feel safe to use the bathroom during the day at school. And you think about that, you go like, wow, that sucks. But what that actually means from an implication perspective is 1 in 10 children in the Aussie heat aren't going to drink water because they don't want to have to pee during the day at school. And imagine instead of learning during school time and making friends, you're spending a lot of your attention focusing on being thirsty, trying to ignore being thirsty, and trying to hold your bladder until the end of the school day because you don't feel safe to pee at school. And what that means is it's not just that school experience, that's their whole educational experience. That's a year, 2 years, 3 years, 4 years of core education. That's the difference between someone going to uni or not going to uni. That's the difference between someone able to go into a trade that they love versus not being able to complete school and go to TAFE. That has a massive impact on the rest of someone's life trajectory. And so
Wow.
when we talk
That's,
about the impact on people,
that's a
that's
really big
huge.
statistic. Mm.
Yeah. Forgive me for 1 second. There is a garbage bin driving right outside my place. I'm just going to close the window. All good.
Yeah.
So that's a huge impact. And that's sort of important to recognize. I mean, I can certainly think of cases where I've gone to a syncope of a child at school on a hot day. How many of those kids were not drinking because of a psychosocial reason, because they didn't feel safe to use the bathroom? I couldn't tell you, but that's certainly something to keep in mind. So when we talk about paramedicine, I mean, we're an amazing profession. Like we get to practice in some of the coolest environments. We have an amazing culture of inquiry. It's a young new profession, and so we're doing really well in general. But I think when I talk about how we're going today, I'm going to talk about us as a broader healthcare system, not just paramedicine, but we as healthcare in general probably need to do better. And we can do better. So the way we can do better is sort of understand the identity spectrum, speak the language, and create a space of trust. And those are sort of the 3 key things I'm going to talk about today. And we need to do better because if you think about certain things like if I have diabetes, I can go see an endocrinologist. I can go see a pediatric endocrinologist. And there's endocrinologists all around Australia. Doesn't matter which state I'm in, doesn't matter where I'm in the state, I can go see that person. If I have heart failure, I can go see a cardiologist. If I'm a young person who is transgender, there is one clinic in half of the states that Australia has, one clinic per state, and only half of the states
Wow.
have that clinic where I can access care. I mean, that's horrendously difficult to access. So it's really difficult to access care if you're a trans patient. And if you're a gay or lesbian or bisexual or non-binary young person, it's also really difficult to access care because your regular GP might not be up to date with this education. Your regular GP might not be a place that you necessarily feel comfortable to talk about these things because you're walking in and you're seeing posters on the wall of a mum and a dad and a young person smiling, and it's already an intimidating place. Like being a young person going to the doctor is not a positive experience. Okay, we're paramedics. A lot of us were actually really interested when we went to the doctor when we were little, but we're not normal. Um, and the doctor represents a tradition thing. It's family. It's they're going to tell my parents things. Um, my mom or dad has taken me to the doctor to see the doctor. Um, so it's intimidating. And when a paramedic rocks up, and we always teach students, we rock up on a person's worst day. And that's something that we're all taught as students. That's a highly stressful time in our lives. Um, Things have come to the fore. People can really be very scared. And if we're able to show a patient who's feeling very scared and very vulnerable that actually we're a safe person for them, not only can we make that process easier, but also we have a unique opportunity where we might be the first health professional to actually connect with someone and make them feel safe to the point where they're able to disclose that they need help or that they are struggling or that, we're talking about young people who are potentially at their point of crisis. And we might be the one who's able to step in during a crisis to go, actually, like, let's talk about why we're in this crisis. And if you've ever experienced it, it's this sigh of relief, explosion of tears, and it's like the young person has this weight lifted off their shoulders for the first time where they're able to talk to a trusted professional about, like, these are all the issues that I've been bottling up and dealing with and the stress that I've been feeling. And if we're able to go like, wow, thank you so much for telling me this. Now let's talk about what the next steps are. That's a life-changing thing that we can do as paramedics. And we're blessed because most health professionals don't have the time that we have with patients. A GP has 10 to 12 minutes with a patient. Nurses in ED have 5, 6, 7 minutes with a patient. We might have half an hour with them. I mean, if we need it, we can take an hour with a patient. Like that's unreal opportunity for us to do amazing things.
It is. I've just got a question. When we're talking about this, about speaking the language and creating a space of trust, and I understand about that. Now, the question that I ask you, and I don't know if there's an answer or if you can put it into words, is how do we recognize how do we recognize a sign that a child is going to open up in a way that they are going to, explore or be able to explain these types of symptoms to us? How can we recognize this
I think
situation?
it's sort of important that we don't go in there trying to draw that out of someone. They'll do it when they're ready. And so the aim is not to walk in there and be like, okay, I'm a safe person, tell me everything. Because that's serving us more than it's perhaps serving them. It's that we, by happenstance, might end up being there. The key is you don't know and you won't know. So it's actually about how do I portray in every clinical encounter that I'm a safe person who can be trusted. And that's not just for LGBTQI people, that's for all people. But there are
Mm.
certain things we can do to modify the way we speak, to use some subtle signals that people who are in a vulnerable position in exploring their identity, who are LGBTQ, will pick up on and go,
Mm.
wow, this person is safe, that I can make some disclosures to them. Um,
Yeah.
and yeah, so you often won't know. Sometimes you
Yes.
will. It's very obvious when you're speaking to a child who has been fostered and supported by their family to express a non-binary or transgender identity, and they're wearing a trans pride flag, and they go, "Hi, my name is this, and I use they them pronouns," and that's awesome. That's quite
Mm.
obvious, but you won't know the majority of the time. And
Yeah.
and that's why we need to probably adapt our universal approach and our sort of standard way of interacting with patients. And that
Mm.
probably comes down to understanding the identity spectrum to start with.
Yeah.
And also understanding a bit about sort of gender identities to start with. And we don't, I think one of the things about paramedics is we often feel nervous in PEDS situations, um, because we don't see them often. They're a minority of the cases we go to. The majority of patients we see are geriatric patients and elderly patients in the community whose care is deteriorating.